At Interim Healthcare, we understand that living with diabetes may be challenging. Our highly skilled team of nurses, therapists, and social workers is here, ready to work with you and your doctor to help you take control of your disease and put you on the path to a healthier life. This path to a healthier life sometimes is straight and easy to follow, while at other times it is rough and difficult to navigate. The key to successfully following the path is to understand and utilize the tools and information available to you. One essential tool is the patient training booklet, which we are happy to review with you. The information in our training booklet is valuable for you, regardless of the various situations in which you may find yourself. For example, you may have been recently discharged from the hospital or the nursing home because of a diabetes complication. Perhaps you were in the hospital or the nursing home because of another condition, but diabetes is a complication of that disease. Maybe you were referred for home health care by your doctor because he or she is concerned that your diabetes is just not under control. So, let's get started and discuss how our team can help you see that diabetes is a disease you can manage and what tools are available to help you do it. Diabetes is one of those diseases we call chronic because it is a prolonged condition. Whether you are recently diagnosed or have had the disease for many years, diabetes is usually progressive and the condition will impact your health and the ability to live comfortably over time. It will also have periods of relative calm, interrupted by some acute crises that may require hospital stays or visits to the emergency room. It is critically important to manage the effects and complications of this serious condition. While the disease itself is significant, the complications of unmanaged or poorly managed diabetes are particularly alarming. These include kidney disease, blindness, nervous system damage, and possible amputation of limbs. Diabetes also increases the chances of other significant conditions and complications. For example, people with diabetes are at much higher risk for heart disease and stroke, dental disease, pregnancy complications, and high blood pressure or hypertension. Individuals with diabetes may often experience functional impairments, which make it more difficult to be independent with activities of daily living and are more susceptible to other diseases like pneumonia. Diabetes is not curable, but it can be managed to significantly reduce the complications of the disease. You've probably already received material to study or have read information about diabetes, but since it is so important to understand what causes the disease in order to manage it, we will review some important points. Our bodies convert the food we eat into glucose, a scientific name for blood sugar, to fuel our cells. Insulin is a hormone normally produced by the body to help in this process. Diabetes occurs when the body either does not make insulin or does not use insulin properly or does not do either. This leaves too much glucose in the blood and too little energy in the cells. There are two kinds of diabetes. Type 1 diabetes is when the body does not produce enough insulin. This kind of diabetes is genetic and is often diagnosed in childhood. The medication used to treat type 1 diabetes is injectable insulin. Type 2 diabetes is when the body makes insulin but does not use it effectively to translate glucose into energy. This kind of diabetes is sometimes genetic, but it is often related to lifestyle behaviors. The medications used to treat type 2 diabetes are oral medications, injectable insulin, or both. The goal for managing diabetes is maintaining an appropriate level of glucose in the blood. When the blood glucose levels are low, you become hypoglycemic and can lose consciousness. If the blood glucose levels are too high, you become hyperglycemic and internal organs like the kidneys and eyes are damaged. The goal of our program is to help you stay on the path to health by keeping your blood glucose levels on track. You can take control of your disease by taking advantage of the information and training your healthcare professionals from Interim Healthcare will be providing you over the upcoming weeks. First, you must decide to live with your diabetes. Educate yourself on its impact and commit to managing the disease, not letting it manage you. If you do this and use the information and tools we provide, you will have the upper hand on your disease. For many people, a critical part of managing diabetes is checking blood glucose levels regularly and logging the results. Your doctor will let you know if checking your blood glucose levels is important for you and will give you a target range for your blood glucose level. You will learn why your blood glucose moves outside of this range and what it feels like when it is out of range. We'll help you know what actions to take and when to take them to be sure you are staying within the parameters your doctor has set for you. We'll help you learn the ABCs of managing your diabetes, all found in your patient training booklet. A. Your A1C test results are a reliable way to measure glucose levels across a 3-month period, not just before a meal. Do you know what yours is? B. High blood pressure is a complication of diabetes that needs to be avoided when possible or measured and controlled. We will show you how. C. High levels of LDL cholesterol can lead to heart complications and are avoided or managed by diet, exercise, and medication. Your doctor will measure your cholesterol several times a year. Proper nutrition is at the heart of successfully managing diabetes. The foods you consume have a significant impact on glucose levels. We'll teach you to read and understand food labels to help you identify nutritional information important to controlling your disease. It is no secret that obesity is correlated with diabetes and that exercise is critical to staying in control. Even individuals at a healthy weight are more successful at controlling their diabetes when they are active. Proper exercise can actually improve the way your body uses insulin. Our physical and occupational therapists will show you how to maintain a suitable activity level to make managing your diabetes easier and more effective. Believe it or not, stress and anxiety can cause your glucose levels to rise and drop. We'll teach you techniques to manage your stress and how to talk to others about what you are feeling. Taking the right dosage of the right medication at the right time is essential to managing any disease, but it is especially important with diabetes. This includes both injectable insulin and oral diabetes medications. Since other drugs you are taking may have an effect on your diabetes, we want you to make sure you have a good understanding of those as well. Nerve damage is a serious complication of diabetes. During our visits, we will do testing and teach you techniques to monitor skin for nerve damage. We will also teach you things you should do if you have nerve damage. Infections, even a cold or the flu, can affect your blood glucose levels. We'll teach you what to do on days when you are not feeling well. Keeping the lines of communication open with your doctor will also make the pathway to health much easier to navigate. You'll visit your doctor regularly. We will discuss ways to help you make those visits more productive, such as sharing a log of your glucose levels with your doctor and planning and remembering to ask questions, take notes, and discuss symptoms during your visit. In addition to the training, our team is available to provide other services as they become necessary. These services may include wound care or giving you lessons on foot care. As you can see, there is much you can do to take control and manage your diabetes. The Interim Healthcare team is here to provide care, support, information, and encouragement as you walk the path to achieve the best quality of life you can for as long as you can, and ultimately stay at home where you are comfortable and happy. The Interim Healthcare team wishes you success on your path to a healthier life.